This is Dee Ann Miller with a message entitled Common Misconceptions About Healing. Before leaving psychiatric nursing to devote more time to advocacy work, I wrote some handouts for my patients. No matter what the trauma, no matter what the diagnosis, no matter if the patient was suffering from a chronic or an acute condition, I found that many profited from one that helped clarify some of the common myths about healing. Hopefully these myths can help you as well. Myth number 1. Emotional healing is a process that's needed only occasionally when one has been deeply hurt. Oh no. Healing is a constant, ongoing part of daily living for everyone. It is required whenever we face a change or crisis. Much of it takes place without us being consciously aware that it is going on. Survivors often feel different or permanently damaged when in reality they're waging an internal war because of cognitive distortions that constitute unwelcome changes in the way things are perceived. Healing requires the adjustment to new understandings, new ideas, new skills, new behavior, and a new self-concept that in time has the potential to produce a healthier person than ever before. Myth number 2. There is a magic formula that I have found if I'm going to recover. That's what people think. I have to find that magic formula. Well, sorry. There are no magic formulas. When I worked with children, I frequently sang a little song to them. Look all the world over. Look all the world over, there's no one like me, no one like me, no one like me. Well, it's true for adults, just as much as for children. In fact, life circumstances can make adult processes even more complex. The way you heal and how fast you do it can depend on your personality, past experience with trauma, how you perceive your present situation, your support system, and many other factors. There's absolutely no right or wrong way to heal. There's no normal timetable, no measuring stick. You're not in competition with anyone else. I might add that the important thing is to keep moving forward. Myth number 3. Professionals are the most important people on the healthcare team. Oh no. You are. You are the most important person on the team. Professionals have a lot of knowledge, but they're not God. They alone cannot bring healing, no matter how much they try. Their work and yours can be undermined by circumstances beyond their control. All of us have our limitations. The most important thing a professional can do for you is to provide a listening ear and accepting, empathetic spirit. The most important thing that you can do for yourself is to act as a member of the team rather than being passive, helpless, and hopeless. Myth number 4. Healing is an event with a definite beginning and an ending. Unfortunately, problems tend to recycle periodically, requiring one to face new issues related to the trauma, even years after saying, I think I'm over that. This can be scary, especially if one is not warned of the possibility. The stages of grieving may have to be repeated when reminders or other traumatic events trigger that old garbage. This is not a sign of weakness, it's a sign of normality. Our losses often involve sub-losses that may not be recognized until years after the initial trauma. Myth number 5. Time heals all things. No again. Ignoring pneumonia usually brings a slow, painful death, and so does ignoring emotional or spiritual pain. While healing is an individual process, finding well-informed professionals, others, and friends who are able to support you can go a long way. So can reading material. You do need time, but time alone isn't the answer. Healing involves a lot of grieving over changes and losses, and grieving is very hard work. It's exhausting. So set realistic goals. Take vacations away from the active process from time to time. Be kind to yourself. Expect things to get better slowly as you are able to take time for the pain.